Welcome to Gross Anatomy, and our first topic will be dealing with the study of the skeletal system or the osteology. First, let us classify the different types of bones in the body. First, we have the long bones. Typically, they have a cylindrical shaft or the diaphysis, and they also have two enlarged extremities called the epiphysis. So, the bone marrow is present in the diaphysis. Take note that there are three centers of ossification for the long bones, and this is of importance in an embryological point of view, compared to the short bones which only have one center of ossification. Typical examples of long bones include the femur, the humerus, the radius, ulna, tibia, and fibula, and as you notice, these are the bones of the appendages. Next, we have the short bones. The general function is to diffuse concussion or to reduce friction. So the short bones are normally present or typically present in the wrist for the carpals and also the tarsals. And as I mentioned, they only have one center of ossification. Flat bones are relatively thin, so they are neither long or short. And the general function is for the protection of organs, as in the case of the brain for the skull. And take note that the skull is composed of several flat bones. They also provide a large area for muscle attachment, as in the case for scapula and pelvis. And in contrast to the long bones, they have deep flow instead of the bone marrow. If you can classify bones as short, long, or flat bones, we can classify them as irregular bones. They do not have a definite shape, that's why they're called irregular, and they have a lot of projections primarily for support and for ligament attachment. A typical example is the bones of the vertebral column or the vertebrae. Other minor classifications include the pneumatic bones. They are lined by mucous membrane rather than the bone marrow. And one good to point out is that they have a communication with the respiratory system, and they are typically the long bones of the birds. So these pneumatic bones make the birds capable of flying because they are lighter compared to the typical long bones of mammalian animal. Aberrant long bones, they can be classified as long bones, but they do not have the three centers of ossification. That's why they are called aberrant. And a typical example is the bones of the rib cage or the ribs. So they don't have the diaphysis and the epiphysis, but they are shaped like long bones. Sesamoid bones are named after its appearance as a sesame seeds, and these bones are developed from the tendons to afford increased leverage. And the typical example is the patella, which is the largest sesamoid bone in the body. This is the kneecap found in your knee. And the navicular bone, which is present at the the proximal interphalangeal joint. These are the two major sesamoid bones in the body, but there's a lot of sesamoid bones present. Aside from that, let us review the different bony features of a bone. As you notice here, there are four major classification, and we can classify them whether they are an articular or a non-articular projection, and also we can classify them whether they are considered a projection or a depression. So first, let us differentiate projection from depression. Projection is any outpocketing or any protrusions in the bone, as you can see here or here. These are called projections. While depression is the concave structure that can articulate with the projection, as in the case of articular depression, or they do not articulate with a certain projection, thus they are termed non-articular depression. So certain examples will be given in the following slides. For the articular projection, the typical example is the head, which is described to have a spherical articular projection, as you can see here. But take note that not all head are spherical in shape. This is the head of the femur, but in contrast to the head of the humerus, this is not typically spherical, and they communicate or project with a structure forming a joint, so they are classified as articular projection. Another example, condyles. Here we have the occipital condyle present at the occipital bone at the head of the skull, and they are approximately cylindrical, and they articulate with the atlas, or the first cervical vertebra. Other articular projections include trochlea. So these are pulley-like articular mass. So it's like a pulley that articulates with a corresponding structure in another bone. When we say facets, these are flat articular surface. So instead of having a round projection, they are flat. So they are facets. They articulate with a fovea, for instance. For the non-articular processes or non-articular projection, a good example is the process. So these are a general term for any bony projections. Take note of this. This is the cornual process. So this serves as the base of the horn. They do not articulate, but they protrude on the frontal bone. That's why they are considered as non-articular projection. Another example is the tuberosity, the major tuberosity of the femur. So they are relatively large non-articular projection. They do not articulate, but it has a certain function for, let's say, muscle attachment. If it's a large non-articular projection, we can say it's a tuberosity, but if it is a smaller projection, we can say it as tubercle. Other non-articular projection, spine. It's a pointed projection or a ridge. So, spine. This is the summarized articular projections and non-articular projections, and you can read them so that you will be familiar with the definition of such projections in the bone. For the depression, let us first differentiate a glenoid cavity with that of a cotyloid. When we say a glenoid cavity, it's a shallow articular concavity. So a good example is the glenoid cavity of the scapula here. While if it is more deep articular depression, we term that as cotyloid. This is the acetabulum of the pelvic bone. So you know the difference between the two. For the non-articular depression, fossa. These are large non-articular depression for muscle attachment. As we mentioned a while ago, the scapula is a flat bone where muscles are being attached. And foramen is a circumscribed hole in a bone. So this foramen is the opening inside the bone. And when this foramen are built together, they will form a canal, as in the case of the vertebral canal. So in the skull, there's a lot of foramen. In the typical vertebra, there's a lot of foramen as well. And here are some of the articular and non-articular depression present in the body: the fovea, the glenoid cavity, the notch, fossa, foramen, and the canal.